You're listening to IChampionHealth Chats, the podcast dedicated to improving health for all in Lexington, Kentucky. Each episode will connect you with champions in our community who will share powerful stories, expert insights, resources to explore, and ways you can promote health for all. Let's lock in and learn how we can champion health together.
Excuse me, Mr. Gio.
Yeah, what's up?
What does it take to become a champion?
You gotta dream, you gotta think, you gotta act, you gotta ball, you gotta bleed, and most important, you gotta believe.
You gotta dream
like a champion,
think
like a champion,
act
like a champion, say I'm a champion. Like a champion,
bleed
like a champion,
look in the mirror and believe.
You're a champion,
You gotta dream
like a champion,
think
like a champion,
act
like a champion, say I'm a champion. Like a champion,
bleed
like a champion.
look in the mirror and believe.
Good morning, and welcome listeners and viewers to an episode of IChampionHealth Chats. Today's topic, basic needs, and we're joining you live today, located in the East End community at the Marksbury Family WayPoint Center at the historic Palmer Pharmacy, which will be open soon to the community. I am your host, Gibson, giving every opportunity, founder of the Operation Making a Change program, community program coordinator right here in Lexington, Kentucky, Fayette County region. Joining me today, my co-host, Rachael Corrone.
Good morning. Like Gio said, I'm Rachael Corrone, and I'm the United Way WayPoint Fellow, as well as the Program Assistant for IChampionHealth. I'm also a PhD candidate here at the University of Kentucky, focusing on community health and community health for all, which is basically what our episode's going to be about today, is basic needs, as everyone has to have those basic needs met before they can work on improving their health.
All right. Thank you, Rachael, for that brief. Okay, so today I want to introduce our guest today, our champion today, Timothy Johnson.
Yes, sir.
Timothy Johnson, he's president and CEO of the United Way of the Bluegrass, a philanthropist who has dedicated his career to eradicating poverty and promoting equity and diversity. Welcome, Mr. Johnson. How are you today, sir?
Thank you, Rachel. Thank you for having me. I'm doing great.
All righty.
Oh, yes. Welcome, Timothy. We appreciate you being here. So first things first, can you tell us a little bit about yourself?
Certainly. So like Gio said, I consider myself a philanthropist. In fact, I sometimes introduce myself as a poverty reduction professional. I have the great pleasure of leading United Way of the Bluegrass, which is a 103-year-old philanthropic organization that serves the 10 counties of central Kentucky. The way we do that is by fighting for the education, financial stability, health, and basic needs of everyone in our community.
That's awesome. And what about your journey to where you are now? How did you get to this point?
Certainly. So that's an interesting journey. I'm going to try to condense into a few sentences. I've worked in the United Way network now for about 17 years. This is my fourth United Way that I've worked for, but the first that I've had the pleasure of serving as president and CEO. I started my United Way journey working at the United Way of New York City, which is home for me. Then moving on to the United Way of Greater Philly and Southern New Jersey. Spent the last 6 years as the Chief Impact and Strategy Officer at the United Way of the National Capital Area in the DMV, as it's called, DC, Maryland, Virginia area. And now I've been here at Central Kentucky for 4.5 years serving as CEO.
Oh, wow. What a journey.
Absolutely.
Oh, awesome. And now we're going to do a little fun question. We have these cards here. We'll open it up and I'll pick a random one and we're all going to answer.
Okay. We got a fun box here. All right.
I can't wait.
All right. So what remains undone that you've wanted to get done for years?
What remains undone that I wanted to get done for years? So my wife and I, we are brand new homeowners. In fact, we went from renters to homeowners since moving here to Kentucky 4.5 years ago. We were fortunate to be able to buy a parcel of land and really figuring out how we want to utilize this land. We're going to create a hobby farm. So we've called it Heritage Hills. That's the name of our property. And outside of building our house and starting to put a few crops down, we haven't really figured out what to do. So I'd like to spend some time sort of visioning what that property will look like, and that's going to be our legacy.
Oh, awesome. What about you, Gio? What remains undone that you've wanted to get done for years?
Oh, man. Writing my book. I want to tell my story to the world. I just think, I have an amazing story on my journey on how far I came and the changes that I've made. So, of course, writing my book, finishing that.
Oh, awesome. And mine is, of course, my PhD. I'm ready to be done with that one.
All righty. So that was a pretty interesting bio, Timothy. So I wanted to ask you, what are basic needs in your own words, from your standpoint, your expertise? What is basic needs?
Certainly. So basic needs, when I think of that term, I pretty much think of immediate, essential needs that every human being needs in terms of access to food, health, safety, shelter. It really goes back to, if you're familiar with psychology, Maslow's hierarchy of needs. It's really the first level of a person can't focus on some of the higher aspirational things in life unless they have the basics taken care of: food to eat, safety, shelter, they're healthy, things of that sort.
Okay. All right. What is United Way Bluegrass mission? What is the mission, and what are you all trying to accomplish?
Certainly. So our mission, as I mentioned, is to fight for the financial stability, health, basic needs, as well as education of every single person in the community. Really, the interesting is the why. The reason why United Way does this is because we have a deep-seated belief. We believe that every person in our community deserves to live a thriving life, have access to safety, as I mentioned, good food, good paying job, healthcare, quality education. We believe that where you live in your zip code should never dictate the level of success that you can achieve in life. So how we do that is by providing access to those things I mentioned, and really being a convener, a collaborator, and catalyst for community action in our community, convening the partners together who may not come to the same table if not for United Way's influence and relationships. Collaborating because a lot of the issues around poverty alleviation are bigger issues than any one entity can address on their own. And we realize that. And really catalysts, using our resources, our dollars, our relationships, our volunteerism and advocacy to really make the change in the central Kentucky community that we are charged to serve.
Awesome. So is there any specific initiatives you all have in place, and how are you all accomplishing these things? How are you doing it?
Certainly. So 3 comes to mind. One is our VITA, which is our Volunteer Income Tax Assistance Program. We're still in the midst of tax year, so to speak, but we do taxes year round. Yeah. VITA is a federal program that's been around for more than 50 years. It's one of the few things that no matter where you sit on the political spectrum, everyone agrees that it's been effective. That's a rarity these days. So if you make less than $62,000 a year, you can get your taxes done through IRS trained volunteers in the community, which will allow you to not only get your tax return without paying fees to paid preparers, but also gives you access to things like the Earned Income Tax Credit and Child Tax Credits and other types of credits that paid preparers oftentimes are not thinking about. That brings real money into households. Last year alone, $5.5 million came back into Central Kentucky households. Over 4,000 people got their tax returns done, which means people are able to invest a little, spend a little, and save a little for the futures. Second thing is 211. 211 is a 24-hour a day, 7 days a week, 365 call center. It's a hotline that you can call, and someone from United with the Bluegrass will pick up the phone. In fact, we cover about 92 of Kentucky's 120 counties. In fact, so 75% of the state we cover. Anything from where can I get access to food? Where can I find a safe place to lay my head? Or any variety of social or health and human service needs, you can call, and we're going to navigate you there. And the third, we're actually sitting in one today, our WayPoint Centers. We launched the WayPoint Centers concept in July of 2021, so not quite 3 years ago. Really what the WayPoint Centers are is a place-based initiative where we're embedded in communities where you can come and have a variety of services met. Regardless of if you need help with having a better relationship with money, you can come to the WayPoint. If you need access to health or basic needs, you can come to the WayPoint. And either we'll be able to provide those services directly here at our centers or give you a warm referral to a partner organization that can help you. So the idea is we want to have no wrong door. We want to embed ourselves in communities so we have great foot traffic. You can just walk on up, which is why being here in the East End, we're excited to be able to open this center really soon. And it's really allowing us to come in the door with the issue that your hair is on fire about, but usually it's not just that issue. So we get a chance to talk with you and figure out what are the deeper issues you have, and how can we help provide services that's going to get to the root causes of what brought you through our doors.
Amazing. So coming from the East Coast, everyone has a starting point in life and reasons on why they got involved with the work that they're doing. What made you get involved with this work?
Well, if I'm completely honest, working in the nonprofit field was totally accidental to me. Right. Clearly, the Most High had a plan. He just didn't let me in on it at the time. My my thoughts was I was going to be a doctor. I was going to be a physician. So I went to my HBCU, North Carolina Central University down in Durham. I was a biology pre-med major. When I came home to finish working on my MCAT scores to go off to medical school, I had an opportunity to, I had a friend who worked for the city Department of Employment and got me a job there to help pay for this Kaplan course that I was taking to prepare me for medical school. And because I was young, I was curious, I was computer literate, I was able to be stolen around the agency from department to department. And one day I woke up and I was 29 and I had been at the city Department of Employment for 11 years, so a third of my life. So I had the decision to make. Do I go back to being a poor college student pursuing this dream of medical school? Or do I look at the body of work that I've learned in workforce development and working with nonprofits and see, is there a career there? And I had someone who introduced me to the United Way of New York City at that time. And I had heard of United Way. I wasn't really sure what they did, but I figured I hadn't interviewed in 11 years. So I would interview, get some practice, and figure out what I want to do with my life, and fell in love with the mission, fell in love with the people who work for United Way, really caring do-gooders. And now, 17 years later, I've been in the United Way network, now leading my own United Way.
Wow. I tell you, ladies and gentlemen, this is amazing. So a position like yours, what is the most challenging being in a position such as yourself?
I think working at any nonprofit, it's not having all the resources that you'd like to have. We are constantly out there fundraising. We're constantly out there trying to attract volunteers to help us be our force multipliers for the work that we do. We're constantly out in the communities. We have 10 counties, so a lot of communities, a lot of cities where we have to be present to make sure that we are hearing about the needs of the community and be responsive to that. So I just joked with somebody earlier that I don't have a 9 to 5. I have a when I open my eyes to when I close my eyes kind of job. So it can be all consuming. And if you're not careful, since I know health is sort of the underlying what we're talking about today is, I have to try to remind myself to think of self-care, healthcare, because self-care is healthcare. Self-care is good for me and it's good for my staff. And if we don't take care of ourselves, we can't be the helpers for the community.
Okay. I get to ask this question all the time with the work that we do. What is the rewards in all of this? What is rewarding to you? What does that look like being in a position?
That's a great question. So when I think about my origins, the reason why I wanted to be a doctor originally was to help folks in communities like the community I grew up in. I grew up in a community called Bedford-Stuyvesant, Bed-Stuy, do or die, back in the 70s and 80s.
I'm a biggie, huh?
Absolutely.
Baby.
And my hope was to really help communities because my community was underinvested in, and as I've gotten into the world of philanthropy, in the world of poverty reduction and nonprofits, there's Bed-Stuys all over this country. In every state I've lived in every community, I've been fortunate to sort of transplant and make my new home. So really the rewards are seeing families, seeing individuals provided with the tools and the resources they need in order to realize their own destinations and their own outcomes for themselves. We don't try to create a plan for someone. We sit down and help co-create that plan because you know where you want to go. You think about the name WayPoint and you think about the imagery of maps. A waypoint is not your destination. It's a stopping place. It's a stopping place on your journey that you can stop and gather resources, gather yourself together, whatever you need to get to your end destination. So the reward is really being able to watch families, watch individuals realize their thriving selves.
Progress. Let's talk about some progress that you've seen in your time of doing the work. What are some progress you've seen that you can tell our viewers and listeners today?
Absolutely. I think that there's a variety of great organizations and resources. Oftentimes people don't know about them. We are our own worst, best kept secrets. So I think some progress has been organizations like mine and other nonprofits beginning to collaborate more and work together. As I mentioned earlier, the problems that we're seeing are large problems. They're population level problems that no one entity can do on their own and solve on their own. But I see great progress with organizations now speaking to each other and collaborating more where, years ago, it would be like Pepsi and Coke not necessarily working together because they see themselves as competitors. But now we realize that, if we all come together, we can serve more people by understanding where your programming begins and ends and where mine can pick up. So really that spirit of collaboration and having shared wins, shared victories, as opposed to being winners and losers out there is some progress that I'm really proud to see.
I guess it's true what they say. There's always strength in numbers.
Absolutely.
Collaborating together as a whole, I think we can make a lot of progress in the world. So, before I wrap my part up, what do you see that the community can use right now?
Certainly. So I would say, we started these WayPoint centers in 2021, and over that time, the majority of the calls that our 2-on-1 call center has received, we've received about 62,000 calls since that time. The majority of them have been around basic needs. In fact, about 45% have been things around utilities, access to rental assistance, things of that sort. I'm starting to see the tide turn where there's more interest and more need, I should say, not necessarily interest, around employment. And whether it's getting jobs or becoming better employed. In United Way speak, we have this group that, we focus on, we call them ALICE. ALICE is an acronym, and it stands for folks who are asset limited, income constrained, but employed. So they're the working poor. People who make more than the federal poverty level, which in itself is a joke, but not making quite enough to make ends meet. So really that population, the working poor, we're seeing more needs for additional skill services, access to these safety net that allows them to continue to work and grow in their employment, allowing them to be able to make enough money to support their families and themselves, thereby getting to where they want to go to.
All righty. Thank you for sharing all that. Thank you.
Thank you.
All right, and now it's time for our wrap-up segment. So where can listeners find support to learn more about basic needs or United Way with Bluegrass?
Absolutely. So for both, I would encourage you to go to our website, which is uwbg.org. We have a variety of resources, not only on what United Way is doing, but on a lot of our partner nonprofits in Central Kentucky area and beyond. Also follow us on social media. That's how you're going to find out when the ribbon cutting is for this new WayPoint Center, the Marksbury Family WayPoint Center at the historic Palmer Pharmacy. You're all invited, the entire community, everyone in my listening voice. We'd like you to come out and help us celebrate this new community gym.
Awesome. And so as you know, the name of this podcast is IChampionHealth, and we ask every guest to fill out our card here that's in the blank. It says, I champion health through blank. So if you could think of one word that you champion health through, what would that be?
I would say, I'll cheat a little bit and say 2 words, financial empowerment. Because I think that's really important to have the resources, to have the knowledge and be able to put that knowledge into implementation, help your family to be healthy, both financially, but also in every other means of physical health, mental health, and otherwise.
Awesome. I was going to say, I'll let you grab a marker and fill that out in just a second.
Indeed.
But who would you like to give a shout out to for their efforts championing health for all in the community?
Oh my gosh, there's so many great organizations. UK Healthcare has been a great partner to us. LFUCG, they've been great partners to us. Social services, there's a lot. I'd hate to name them because I'd leave some out, but I would just say it takes a village. It really does take a village to help our communities gain the resources they need in order to be thriving, because they deserve nothing less.
Oh yeah, and that collaboration is so important. So what's the one message you want listeners to take away from this conversation?
That there's always a way of getting involved. So whether it's volunteering for a local nonprofit, whether it's advocating for change in the community, giving is also important, providing resources for the work to continue. There's nothing that prohibits everyone from getting involved. Just find your lane, and no matter what you contribute, time-wise or resource-wise, it's put to good use to really help advance our community.
Timothy Johnson, ladies and gentlemen. Again, thank you, Timothy, for blessing us with your presence, man, and sharing with the community and our listeners and viewers all the great work and resources that you have available. We appreciate that.
Thank you.
All right. So again, listeners, viewers, be on the lookout for more episodes of I Champion Health. I am your host, Gibson, give you every opportunity, and my co-host,
Rachael Corrone.
All right. Be on the look for more episodes.
Thank you for tuning in to IChampionHealth Chats. If you enjoyed this episode, please be sure to hit the follow button in your favorite podcast app and share with your community. You can connect with us by searching at IChampionHealth on social media or by emailing ichampionhealth@uky.edu. IChampionHealth is a collaboration between the University of Kentucky Prevent Alliance, Operation Making a Change, and the United Way of the Bluegrass. The IChampionHealth team encourages you to get vaccinated for COVID-19 and stay up to date with boosters. Vaccines are a safe and effective way to protect yourself and your community. This podcast was supported by funds made available by the Kentucky Department for Public Health's Office of Health Equity, from the Centers for Disease Control and Prevention, National Center for STLT, Public Health Infrastructure and Workforce, under RFA OT 21-2103. The contents of the podcast are those of the authors and do not necessarily represent the official position of or endorsement by the Kentucky Department for Public Health or the Centers for Disease Control and Prevention.